Anesthesia in developing brains implication of FDA warning. Definition. The main definition is a study of very single exposure for relatively minor procedures having observed the long-term adverse neurodevelopmental effects that have been observed after prolonged or repeated anesthesia administration are difficult to interpret because of confounded by indication. Otherwise, healthy children do not undergo lengthy than 3 hours or repeated procedures under general anesthesia. The data for studies in animals demonstrate that under experimental conditions, general anesthetic testing included both N-methyl-D aspartate and antagonists of aminobutyric acid, agonists having limited neuroanatomical consequences not necessarily long-term lasting. It's not permanent. The functional effects in special ranging from randomized to non-immunic primates.
On Wednesday, the FDA, Food and Drug Administration, issued a warning for expectant mothers and children under 3 years of age. Repetitive or long-term use of general anesthesia or other sedation drugs for longer than 3 hours could be harmful to the developing brain of a fetus or child. In an agency news release, Dr. Janet Woodcock said, "We recognize that in many cases these exposures may be medically necessary, and these new data regarding the potential harms must be carefully weighed against the risk of not performing a specific medical procedure." Dr. Woodcock hopes the new insight will help patients and physicians make informed decisions surrounding medical procedures.
Applications in medicine. Was recently interim analysis, general anesthesia, spinal anesthesia study, and pediatric anesthesia of the neurodevelopmental assessment. The study, which involved primary neurodevelopmental testing, reported that a brief single exposure to general anesthesia was not associated with poor neurodevelopmental outcomes. They have conducted another study, that also specifically addresses prolonged anesthesia in young children and are expected to report data in the next few years. There are no data specifically assessing any association in exposure in utero in human fetuses with the postnatal and neurodevelopmental outcomes.
Greater than a year of age, as the risk seems to be greater in this very young patient population. The authors also point out that it's important to remember that anything we can do to minimize the dosage of anesthetic that children are getting probably helps as well. And this would include things such as regional blockades using topical or local anesthetic.
Pros and cons. The pros: the only drugs in clinical use of sedation anesthesia that not cause degeneration in animals are dexmedetomidines and opioids. In rare cases, lower abdominal or lower extremity procedure can be performed under spinal anesthesia in young infants. Cons: there are no alternatives to these general anesthetic drugs for children younger than 3 years of age. Indicated procedures in pregnant women that have young children that can safely be delayed are rare. The only other drugs in clinical use for sedation and anesthesia that cause neurodegeneration in animals are dexmedetomidine and opioids, but these agents are not sufficient for general anesthesia and do not represent a feasible option by themselves.
Thousand patients, and the age ranges are up to teens, is that right?
That's correct, between 7 and 20 years of age. Another interesting feature of the study is that we're doing a test that the FDA themselves has actually used to study the effects of anesthesia in monkeys. Turns out that monkeys will work for food pellets. Children will do the same test for nickels. So we brought in the children and had them do the same test that the monkeys do. And so they have seen that the monkeys are affected in this test if they are exposed to anesthesia. We hope to be able to directly compare and see if we see the same pattern of results in children who have had anesthesia as well.
Fascinating. We'll have to have you back on in the spring to talk about it. Sumathi, what do doctors now tell you they are being asked more repeatedly by parents, and are they asking for more localized anesthesia?
Yeah, some doctors I've talked to did say for certain procedures like hernia repairs, you can do local anesthesia with the spinal cord. So there are requests, but in a lot of surgeries and the more complicated ones that are taking more than 3 hours or that require different stages, it can be there's no local anesthesia sort of alternative.
Right.
So.
Sometimes there are no options.
Exactly.
Right. Sumathi and Dr. Warner, thanks.
You should apply unipolar. There are several children under 3 years old and pregnant women unipolar who require surgeries that are performed under anesthesia, but there are not or rare cases of neurodegeneration unipolar proved to be caused by anesthesia and the sedans opioids.
Absence of normal environmental stimuli during sedation, absence of normal feeding, etc., could play a role instead, she says. The changes the researchers sought of gray and white matter in these babies' brains, however, could have important effects on development. Previous research has found that the growth of concentrations of gray and white brain matter in the cerebellum and hippocampus predicts how quickly and well a child's language skills will develop. The infants that have had surgeries involving prolonged or repeated sedation tended to have more fluid than other babies on their brains, putting them at greater risk for a variety of cognitive and sensory problems. The brain system of ventricles and cerebrospinal fluid feed the mind's neurons critical nutrients.
Conclusion. The warning will raise concerns and questions among practitioners, pregnant women, and parents of young children, questions for which there are currently no correct answers. It will also change medical practice for any of the estimated 1.5 million and 2 million children under 3 years of age who undergo anesthesia annually in the United States.
Literature so that some of the clinicians could use this information. So I'd like to start with how do human studies reveal about the effects of general anesthesia on neurocognition. So far, the only published studies out there have been retrospective studies. They're epidemiologic or cohort studies. One of the most quoted studies was written by Robert Wilder out in Minnesota, which involved a database of over 5,000 children born in Olmsted County, Minnesota, from 1976 to 1982. And this study determined that children who had received 2 or more anesthetics in the first 4 years of life had roughly double the rate of cumulative school difficulties compared with children who had no anesthetic exposures. So it's kind of a little bit of a scary study, I think. In this study, there was no increase in learning problems in children who had a single anesthetic exposure. Okay? Caleb Ng, also of Columbia University, analyzed the Western Australian pregnancy cohort, or the RAIN cohort, of children born between 1989 and 1992. This cohort was originally designed to examine the effects of pregnancy ultrasounds on neurodevelopment. Of the 2,608 children assessed in follow-up, 321 were exposed to anesthesia before the age of 3. I think this is important. It shows that 11% of children in this particular cohort had general anesthesia before the age of 3. In addition, he found that there was an increased adjusted relative risk ratio for disability in language and cognition, which persisted even after a single exposure to anesthesia. However, there are several studies that show that there's no association between early anesthesia exposure and later learning difficulties. In the Netherlands, a study looking at identical twins found that twin pairs in which only one of the twins had general anesthesia both had lower neurocognitive scores compared to twin pairs in which neither twin had a general anesthetic exposure. So it appears that it wasn't the general anesthetic exposure that was the cause of their learning difficulties. A large cohort study from Denmark found no evidence that children who had inguinal hernia surgery as infants did worse on national achievement examinations done at age 16.
Thank you.